Then. Good afternoon and welcome to Workplace Safeguards to Reduce Risks of COVID-19, a webinar presented by MU Extension's Labor and Workforce Development Team as part of the Workforce Transitions Rally Series. My name is Leslie Fisher and I will be facilitating today. This webinar is 1 hour long, covering robust content from the Missouri Department of Labor's On-Site Safety and Health Consultation Program. All participants are muted for the duration of the presentation. Please submit your questions via the chat function to the right of the screen. Our presenter today is Daniel Stark, Assistant Director and Program Manager of the Missouri Department of Labor's On-Site Safety and Health Consultation Program. Daniel has served the Missouri Department of Labor in this capacity since 2007 and brings industry insight and a wealth of knowledge to us today, gained through more than 20 years of experience working as an occupational safety and health consultant and industrial hygienist. We are honored to host you all today, and with that, I'll turn it over to Daniel.
All right, thank you, Leslie. Again, my name is Daniel Stark. I'm the Program Manager at the Missouri On-Site Safety and Health Consultation Service. And basically what we do is we're invited in by small businesses throughout the state of Missouri to help them get in compliance with OSHA, and not only help them get in compliance with OSHA, but hopefully develop a good safety and health management system. Our service basically is designed for small employers, but the kind of industries that we go to are boundless. We go to nursing homes, we go to greenhouses, John Deere dealerships, funeral homes, all different types of businesses. And it's just a real huge variety of different industries that we can provide our services. But today we're going to concentrate on probably one of the more perplexing issues going on right now. That's COVID-19. Workplace safeguards to reduce risk of COVID-19. So what we're trying to do is reduce the risks of employees coming back to work through this presentation. Today's objectives include have a basic understanding of the Missouri On-Site Safety and Health Consultation Program. We've been accused of being one of the best kept secrets in state government, and we're out to dispel that. So we want everybody to know about the services that we can provide and its many benefits. We want to be familiar with the steps of an infectious disease preparedness plan. Any type of emergency or any particular hazard that we're dealing with, we want to create some sort of a plan. So we're going to talk about that. We're going to talk about the steps businesses can take to reduce COVID-19 exposure. Know what engineering and administrative controls that can be used to control COVID-19. And then finally, we'll be familiar with the OSHA requirements related to COVID-19. So, as you try to mitigate some of these hazards with COVID-19, a lot of times it could inadvertently kick you into some OSHA compliance issues, and we're going to talk about that. So we're going to first spend a few slides just talking about the Missouri On-Site Safety and Health Consultation Service. Back in 1970, Richard Nixon signed into law the OSHA Act, which reserved the right for employees throughout the United States to have a safe and helpful workplace. It's about 1975 that OSHA began to realize that a lot of small businesses throughout the United States was having a really hard time getting in compliance with these OSHA regulations, because when he signed into law the OSHA Act, a lot of voluntary safety standards automatically became law, and it put a pretty good burden on small employers to comply with these safety and health standards. So what OSHA did was they created a OSHA consultation program that's run through the states. The actual standard or the federal law that talks about the OSHA consultation program is 29 CFR 1908. In January 1978, Governor Teasdale signed an executive order establishing the consultation program in Missouri. And we started doing consultations about October 1, 1979. So we've been in existence since 1979. The program is 90% federally funded and 10% state funded. We required 90% of our federal or funds from federal OSHA, and then the state of Missouri matches 10% of that. So each year I have to write a cooperative agreement with OSHA on how many visits we're going to do, what types of industries we're going to try to target with consultation, and then they give me 90% operating funds. Then the state of Missouri, through the legislature, provides us 10%, the remaining 10% funds to operate. With the program, we basically conduct like an OSHA type mock inspection, and a lot of times that's what the employers are interested in having us come in and do. And there's really two main reasons why I believe we can do a good OSHA type mock inspection. One is that we attend the same training as the OSHA compliance officers do up in Chicago. So we sit shoulder to shoulder with compliance officers throughout the United States and get trained on the same standards, the same letters of interpretation, basically, the same ways they enforce the standard as the compliance officers do. The second reason I think we can provide a good OSHA type mock inspection is that they provide us copies of the citations that they're writing throughout the state of Missouri, not only in Kansas City, but also St. Louis. So we can review these citations and kind of look for trends where OSHA is spending more time or citing this particular issue more than others, and we can pass that information on to the employer. With the program, there are no fines, penalties, or citations. OSHA enforcement does all of that. We do not do any of that. And as I mentioned earlier, with the funding arrangement, the 90-10 funding arrangement, we can provide consultation services to small employers at no cost. So the program is free to utilize. The program is also confidential. We don't tell anybody where we go, especially OSHA. And it's important that we have a dividing line between the consultation people and the enforcement people. We don't share any information to OSHA or, for that matter, anywhere else or to anybody else about where we go. The main obligation that an employer has when they participate in the consultation program is they have to correct the serious hazards that we identify while we're there, or any imminent danger situations. In fact, the imminent danger situations have to be corrected before the consultant leaves. And for some reason, an employer refuses to correct a serious hazard or an imminent danger, then by law, we have to refer that employer back to the OSHA enforcement people. However, since we've been in existence since 1979, we've never had to do that. And to my knowledge, we've never had to do that. So we've got a really good track record of not making any referrals to OSHA. And we really work with the employers to try to get all hazards corrected appropriately and on time. So, and as we identify serious hazards, we give the employer a certain time frame to correct those particular hazards. Usually it's about 30, 60 days, something like that. So if anybody is interested in learning more information about the consultation program, feel free to visit our website. It's at labor.mo.gov/onsite, or feel free to give us a call at 573-522-SAFE. All right, so that's a little bit about my program. I want to move on to the topic of the day, which is steps to reduce workers' risk of exposure to COVID-19. So, this is one of the biggest things going on right now is COVID-19. The CDC has put together and OSHA some guidance on this, but this is going to be just a general overview of things that employers can do to reduce employees' exposure to COVID-19. However, there are some industry specific guidance that the CDC and OSHA has put together, and I'm going to talk just a little bit about that here in a little bit. By now, a lot of us kind of already know how COVID-19 spreads. It basically spreads, close person-to-person contact, and close meaning, less than 6 feet away from each other, from the other person, through respiratory droplets, from coughing, sneezing, and talking. And that's kind of been shown as the primary means of transmission. Another way you could possibly get it is through touching surfaces and then touching your mouth touching contaminated surfaces, then rubbing your mouth or nose or eyes. And that's not necessarily the primary way. It's a less common way, but it is a possible way that you can get it. And then also asymptomatic people, meaning people without symptoms, has also been shown that there's a possibility that they can spread the virus to others as well. So this is the basic way that COVID-19 spreads in the community and in the workplace. All right, some of the factors that affect workers' risk of exposure to COVID-19, basically your distance between workers. Obviously, if you have workers working closer together, there's going to be a higher probability of transmission, okay? Also, if you have a longer duration of exposure with a particular person, if you're working with somebody really close over a period of 8 hours, as opposed to just working with them for 30 minutes or an hour, that's going to affect the probability of transmission. Again, if you're with that person, next to that person for a complete 8 hours, that's going to affect your chances of transmission. And then also the type of contact. We just covered that. Person-to-person contact or contact with a surface of some kind is going to affect your transmission. So what we basically do here is, or what I've done here is basically laid out a step-by-step procedure on things that we can do to get ready for COVID-19 if we're not already, and to lessen our exposure to the virus. So the first thing we want to do is develop an infectious disease preparedness and response plan. And we want to be sure to make this specific to your workplace, okay? A lot of times when we talk about response plans and just any type of written safety and health program, you'll get it off the internet. It'll be like a generic plan. And that's not really going to do you any good. It has to be specific to your workplace. We also need to, or what needs to be included in this plan as well, as where and how and what sources of COVID-19 might workers be exposed to. Okay, and we need to take into consideration, is it the public? How are we gonna take care of the public coming in? Customers, co-workers, how are we gonna handle sick individuals that come into the work site? What is our procedures now for international travelers, if we have any international travelers? Okay, that needs to be included. Those three things need to be included in our plan about how we're gonna handle particular individuals. Risk factors at home and in the community. Risk factors also come into this plan. If you are part of a huge family that lives in a small house, those are type of factors that's going to influence transmission. Or if you're in a type of community that's had an outbreak all of a sudden, that's going to affect what we need to do as far as decreasing the possibility of transmission. Workers' individual risk factors. We got to take that into consideration too. If we're a lawn care company where most of the workers that we hire and are working are 20-something individuals in good health, that's a little bit different scenario than, if we have a different type of company where the majority of our workforce is more at risk, an older population. That's another factor that we have to look into and adjust accordingly. What controls are going to be necessary to address these risks? I'm going to get into controls a little bit, but controls can basically entail engineering controls, administrative controls, and personal protective equipment. What controls and what order are we going to address these risks? And then most of all, I think, it's really important that you get employee input, because they're the ones that are working every day on the lines. It's important that you get their input and say, and hear their concerns about what they have. They'll give you a lot of really good feedback on, where are the particular issues that we could have a high likelihood of transmission or exposures, okay? And then also get union input, maintain good communication with union and get their input on their members' concerns, okay? So all of these items should be part of a preparedness and response plan. Step 2 involves developing procedures to identify sick workers. We need some sort of procedures in place on what are we going to do with sick workers, okay? So if an employee comes in experiencing COVID type symptoms, how are we going to handle those employees, okay? Those types of employees also, or all employees, need to be trained on what to look for to self-monitor for any signs of symptoms, whether they have shortness of breath, a cough, body aches, fever, all that sort of stuff. They need to know about those sort of symptoms to self-monitor for. And then also, some employers may take advantage of temp agencies or contract workers. And if we're utilizing those types of agencies, they need to be on the same page as what you're trying to do. Okay, so you don't want to have all these things in place and then your temp agency is basically doing nothing to help control COVID. So you need to be on the same page as far as how you're going to identify and deal with sick workers. Okay. All right. Step 3 is basically how we're going to implement our controls for COVID-19. Okay. And this graph here basically is what's called the hierarchy of controls. In the safety and health profession, this is the main thing that we use when we look at any type of hazard control. Okay. And a lot of pitfalls that we run into, everybody runs into this type of pitfall, is that, I see a hazard and I'm automatically going to put my people in respirators. Just boom. Don't even think about it. Just put them in masks or put them in respirators, okay? And that's not really the right way to think about it. The way to think about it is step through these hierarchy of controls. And as you can see at the bottom, or from top to bottom, we're going the most effective controls to the least effective controls, okay? So elimination, substitution, engineering, and administrative PPE, elimination is the most effective control out there if we can simply eliminate it, okay? The next one down is substitution. However, with COVID-19, we really can't substitute it for something else. We're stuck with it, okay? So we have to deal with it. So in that case, it's not really applicable. But we're going to get into the specific examples of engineering, administrative, and PPE controls as we go on here. So as I mentioned, elimination is a control for COVID-19. It's very effective at eliminating the exposure to the particular hazard. However, in most cases, it's not really that feasible, okay? We all have to work. We all have to buy groceries. We all have to, be part and, do our life, do life, okay? We can't just all be stuck in a home and have everybody give us things, okay? So elimination, yes, is a good control, and being isolated is a good control for COVID-19. But in a lot of cases, it's not feasible, okay? So let's move on to the next one. Engineering controls for COVID-19. In engineering control is basically something that we produce that controls a particular hazard without the human even being involved, okay? Whether it's a barrier or a guard or something like that. Engineering controls are put in place that we really don't have to do anything as long as they're in place and the human can go ahead and do the job without worrying about the hazard, okay? Within the context of COVID-19, some examples of this are high efficiency air filters. And so this is something that we can utilize in our workplace, specifically your HVAC system, to improve the quality of the air. So what we mean by high efficiency basically is there's basically a tighter context of woven fabric in your air filters And that basically collects more air contaminants than a normal air filter would do, okay? The upside is it collects more contaminants, but the downside is it's gonna be harder for your fan to work to pull air through that filter, okay? So there's a little bit of a trade-off there that you kind of got to think about. Increasing overall ventilation, what we mean by this is like dilution type ventilation. You're bringing more air in, can be a control measure for COVID-19. However, we have to be careful how we're placing our fans, or if we're using cooling fans, we got to be careful how we place those fans, okay? As an example, if we're in a doctor's office, we wouldn't want to have our fans blowing from the doctor's office where they're doing the procedures out to the reception area, okay? That's bringing all the contaminants out to people that don't need them, okay? So on the other hand, but if we bring it the other way, if we bring it from the clean air to the more contaminated air, we remove it right there, we're going to be a lot better off. So you got to be really careful and think about what's going on downstream if you utilize cooling fans. Installing physical barriers such as clear plastic sneeze guards are examples of engineering controls. And I'm going to show a good graphic on this here in just a little bit. But if that physical barrier, again, is in place, then we really don't have to do anything. We can continue our work and do our jobs. Installing drive-through windows also provides some distance between ourselves or the public and the worker. Okay, it's kind of built in with that. And then we can also utilize negative pressure rooms. And this is mainly used more in healthcare settings for really kind of toxic atmospheres, or if you have a pretty bad bug or something that you're trying to get rid of, they utilize negative pressure rooms. And the best way to describe this, what a negative pressure room is if you've ever gone into a room and you kind of left the door open, and as the ventilation system kicks on, it slams the door shut. Well, that particular room is under negative pressure at that point. And that's kind of what you want, is you want air to filter into that room and then be removed in some fashion. And the opposite of that is a positive pressure room. Like when you leave the door open and the air kicks on and it blows your door open, you can tell that room is slightly under positive pressure. But the HVAC guys typically will try to get these two equalized, so it's neither positive or negative. But if you're trying to get rid of a contaminant, a negative pressure room is what you want. Okay, that kind of covers some examples of some engineering controls. All right, this graphic was made by the Center for Disease Control, and it kind of illustrates a couple really good concepts as far as administrative controls, which I'm going to talk about, but also engineering controls. So if you look at the top, what we have here is basically a conveyor line system going from your left to right, okay? And you've got 4 workers, you got 2 on each side, and then you have them less than 6 feet apart. So this is a bad situation here, because not only they, are less than 6 feet apart on their left to right, but front to back, there's also less than 6 feet, okay? But if you go down to the next tier, if we can just simply remove the 2 workers that are across the conveyor belt and then increase the distance between the 2 workers on the left and right, that's a lot better situation, because we're maintaining that 6 feet of distance. And then on the 3rd tier down there, if we simply just put a barrier between there, that will further increase or decrease the possibility of transmission, because not only do you have 6 feet of distance, but you have a physical barrier there that's going to prevent anybody from being exposed between the 2 workers on your left and right. And then the best situation is that they're at the very bottom, where you have not only have the partition, but then you have another partition going from your left and right, like a horizontal partition. And then you can add those other 2 co-workers in, and from a productivity standpoint, you're right back to where you were on the top example. Again, these are just some examples of engineering controls that can be added to prevent exposure to COVID-19. All right, moving on down to the tier, the next level is administrative controls. Again, they're not quite as effective as engineering controls, but still pretty good, work pretty well. A classic example of this is keeping workers at home, stopping face-to-face meetings, starting teleworking, stop non-essential travel, working alternate work shifts, limit access to the workplace. The state of Missouri has pretty much all those first ones that I just talked about. We've started doing that probably since the middle part of March. No touch trash cans, hand sanitizer with at least 60% alcohol, requiring regular hand washing and posting hand washing signs in restrooms. All of these are examples of administrative controls. Continuing on with administrative controls, simply covering coughs and sneezes, providing customers in the public with tissues and trash receptacles. Don't use another worker's phone or desk, and then establish routine cleaning with EPA approved disinfectants. With this last one here, it could be kind of challenging to come up with, your traditional types of cleaning products, like your Lysol wipes or Clorox wipes and that sort of thing. But later on, I got a resource link that I'm going to show you that you can go to this link and type in some sort of product name, and it'll show you if it's approved to disinfect COVID-19 or not. And I think it'll be a good alternative, or you'll be able to see some alternative products that you can use if some of these other products are not, or you're on limited supply. So I think that's a really good link, and I'll show it to you here in just a little bit. Okay, so personal protective equipment. Okay, again, this is our last line of defense against a particular hazard, because all of the responsibility is on the worker or on the user of that, okay? It has to fit right. The employee has to store it correctly. They need to know how to use it. All these things come into play when we look at personal protective equipment. And up to some point, personal protective equipment will fail, okay? It will always fail. Unlike an engineering control, where if we have an engineering control and at least it's properly maintained, it's probably going to do its job. But any type of personal protective equipment will fail at some point. Face coverings are not considered personal protective equipment, mainly because they're meant to keep the whoever's wearing those. It's basically an infection prevention type apparatus, okay? Whereas with a respirator is basically designed to provide you clean breathing air, okay? So I know it's a little bit confusing that I added face coverings in with personal protective equipment, but I did want to make that distinction that face coverings are not considered personal protective equipment. However, if you can't maintain that 6 feet of distance, you're going to need to wear some sort of face coverings. And one thing to keep in mind about face coverings is that when we cough or when we sneeze, the size of those molecules or those droplets can range from like 0.5 microns to 50 microns, and we can't even see below 10 microns, okay? So the face coverings, just through their design, will probably do a decent job of filtering the bigger droplets when somebody coughs or sneezes, but they're not going to get the really small things, okay? Not like an N95 respirator would do, okay? if we do have N95 respirators, not only is it going to provide infection control, but it's also going to provide the user with clean breathing air. It's good protection. They design a N95 respirator to filter the hardest particle there is, which is a 0.3 micron particle, to filter that out for it to achieve its certification, its NIOSH certification. But right now they're really hard to come by. All the medical establishments are using them. But if you do use those, you might have to implement a respiratory protection program that's required under OSHA. So if you as an employer provide these respirators with the intent of protecting the health of your workers, you have to have a complete respiratory protection program. However, if an employee comes up to you and says, I'd feel better if I just had one, and they wear one, they're using it voluntarily, then that cuts a lot of the requirements out as far as a complete respiratory protection program. At that point, you just have to have a copy of Appendix D of the standard, which basically just talks about, you're wearing this respirator voluntarily. Please, take care of it. Don't store it in contaminated environments, and that sort of thing. So as an employer, you have to make those distinctions there. Face shield's another example of personal protective equipment. It does a pretty good job. Obviously, it doesn't seal quite as good as like a normal respirator, but it can do a job in helping to prevent infection. And as far as wearing gloves go, I don't think that's probably a good idea. And the reason for that is because, if I'm an employee and I come in and work and I'm wearing gloves and I never take those gloves off throughout the entire day, there's a good chance that I'm going to be spreading the contaminant all through that work site. I think we're much better off, using hand sanitizer and consistently and constantly washing our hands, as opposed to the possibility of spreading that virus. Now, if you're in a healthcare setting, you really have no choice. You have to wear gloves because the possibility of contamination is imminent, and so there's a high likelihood you could get contaminated. So there's a distinction there, but people wearing gloves to the supermarket, it's just not a good idea. So, all right, so that kind of covers personal protective equipment. And again, that's our last line of defense, or last means of control. Step 4, we can look at screening of workers for COVID-19. And this is, the CDC considers this an optional thing, something that, it's totally optional. And this is where you're asking, the workers that come in, have you had any COVID symptoms within the past 24 hours? You might also be involved with temperature checks. However, I would caution that if you do temperature checks, both the person taking the temperature and the person that's getting checked both need to wear some sort of personal protective equipment. Okay, we've kind of been seeing some of that not take place. The person taking the temperature may wear theirs, but the other person is not. So again, we're trying to prevent contamination for each other. So both parties need to be wearing some sort of personal protective equipment or a face covering to prevent contamination. And then if any employee answers yes about symptoms, or they have a temperature, then they need to go home. Okay. As I mentioned at the beginning of the presentations on COVID-19, there's general guidance, which I kind of just provided in the previous slides that I just talked about, but there's more specific COVID guidance, and they're coming out with new industries every day. So the list here is just an example of the specific guidance that OSHA and the CDC has put out. So if there's employers in any of these occupations, definitely go to the more specific guidance that will give you exact guidance on what we need to follow, and kind of speaker language as far as industries go. Okay. Okay, this next graphic is called a decision tree. So basically what you can do is start on the left here, and it gives you some sort of framework on how you're going to decide if you're ready to open up your business or not. You know, have you taken the appropriate safeguards? Okay, so start at the left, it's kind of like a flow chart. You know, you answer the questions and then you go on. If you answer yes, then you can move on to the next one. And if you answer yes to that one, and then you can move on to the next one. And then it gives you the indication that you're open and kind of monitor the situation of what's going on. So up there is the link to that tool. If anybody wants to access that tool, I provided the link there for that. And then finally, step 5, we want to ensure compliance with OSHA standards. So what I talked about earlier, you know, a lot of times, you know, we're trying to control a particular hazard that kind of kicks us into other OSHA standards that we have to comply with. And if we're using like goggles or gloves or face shields or anything like that, that could kick us into what's called a personal protective equipment program, and that standard is found under 29 CFR 1910-132. The main requirements of that particular standard is that you have to do a hazard assessment to determine what type of personal protective equipment you're going to need, okay? And that has to be signed off on by a supervisor. And then once the hazard assessment has been completed, then you have to do the training on that personal protective equipment. Where are you going to store it? What's its life? You know, how are you going to ensure that it's going to fit correctly? You know, all those things have to be covered in a personal protective equipment program. Respiratory protection program, again, touched on that briefly, but if you provide your employees with an N95 respirators or N95 respirators, and you tell that employee, you know, I want you to wear this is mandatory to protect your health, then you have to have a complete respiratory protection program. However, if you have or provide the employer or the employee wants to wear this particular N95 respirator voluntarily, then you have to provide them a copy of Appendix D of the standard. And then again, face coverings are not considered respirators. Another standard that you might have to comply with now, if you're changing up your cleaning chemicals, is the hazard communication standard, and that's under 29 CFR 1910-1200. So if you're adding any type of cleaning chemicals that you didn't normally have, you need to be sure you have a safety data sheet on that particular chemical, and then you need to be sure those chemicals are appropriately labeled and that the employees have the training for that particular type of chemical, okay? And another really good place to go and that lists all these standards is OSHA's website, which is osha.gov. The easiest way to navigate the OSHA website is go to osha.gov, go in the upper right-hand corner and go to the A to Z index. And to find these particular standards, what you'd want to do is click under S under standards and look for 1910 standards, which are general industry. If you're in the construction industry, then it'd be under 1926. Another component of OSHA guidance, or excuse me, OSHA compliance is appropriate record keeping. So a lot of you may be familiar with OSHA's record keeping guidelines, but if we have 11 or more employees, typically we have to maintain something that's called the OSHA 300 log. And this is a recordable case. So if we have an accident, somebody cuts their finger, requires stitches, something like that, that may go on, that may be a recordable case that goes on the OSHA 300 log. For a COVID-19 case, we have to meet all three of this criteria. It has to be a confirmed case of COVID-19. It has to be work-related, and the case involves one or more of the general recording criteria set forth in 29 CFR 1904.7, okay, which basically constitutes whether it's medical treatment or is it first aid, okay? So in other words, it kind of all depends upon the circumstances of the COVID-19 case, whether it's going to belong on the OSHA 300 log or not. Okay. Okay, to wrap things up here, some resources, again, that I put together. This first one is OSHA's publication on guidance on preparing workplaces for COVID-19. It's a good publication. Another good resource to have is Back to Work Safely from the American Industrial Hygiene Association. Previously, I talked about those lists of disinfectants. That is the link that you can go to. You can click on that link, and then you can actually do a keyword search. Let's just do a search under pledge or something like that. That'll let you know if it's appropriate COVID disinfectant. And then if you have specific questions regarding the OSHA's respiratory standard, the Small Entity Compliance Guide is also a really good one to have, and that's the link for that one. Okay, to review the objectives, hopefully everybody has a basic understanding now of the Missouri On-Site Safety and Health Consultation Program. We're kind of familiar with the steps of an infectious disease preparedness plan that we need to have in place. Know the steps we can take to reduce COVID-19 exposure. You hopefully learned about the hierarchy of controls and the importance of elimination, engineering, and administrative controls, and know that personal protective equipment is our least favorable means of protection. And then finally, I think hopefully you've gained some understanding about, if we're trying to prevent COVID-19 exposure, what are some of the OSHA requirements that we have to now comply with. So that concludes my presentation.
Thank you, Daniel. That was a phenomenal presentation. Let's see. We've got a question that came in over the chat. What is one misconception you would like to address for our external audience? OSHA, we're kind of in regards to OSHA mock inspections.
We constantly battle the problem of, if we have, if we do a consultation, well, they'll just turn you into OSHA, okay? We constantly battle that, and that is not true. Any employer who utilizes the program, their confidentiality is protected by federal law. So we cannot tell anybody where we go when we do a consultation. That's probably one of the biggest misconceptions that we run into.
And then we've got another one. What are some of the easiest preventable violations?
Oh, I think some of the more preventable ones are labeling of containers. I talked about hazard communication, just keeping labels on containers. If you put it into, if you buy a container of something, let's say WD-40 from Walmart, and then you put it in a secondary container, make sure that secondary container is labeled with at least the identity of the chemical and the appropriate hazard warning. A lot of times we also see a lot of electrical type violations where, on outlets simply don't have faceplates. And it's not uncommon that I see a violation for a faceplate missing on an electrical box that cost an employer, $3,500 for a 79-cent faceplate, okay? So watch your use of extension cords as well. Extension cords are meant for, a lot of times employers will use those in lieu of permanent wiring, and they're not really designed for that. Or they have a broken ground pin on them, or the cord it's got a bad nick in it. And if you have a cord with a bad nick in it, you just basically need to replace that cord. So, so those are just some examples of easy to fix sort of things that OSHA can nail an employer on, and it's so unnecessary. So.
Okay, thank you. And then what rights do employees have in response to COVID concerns, and what does the process look like for filing those concerns?
I'm not really I'm not really an expert on the different types of rights on that. Now, if an employee believes that there is a legitimate safety problem or a safety concern related to COVID-19, what they can do is file a formal complaint with OSHA, and OSHA will go out and address that complaint.
Okay, thank you. And then do you have any success stories where programs have really made a difference for employees and employers?
Yes, absolutely. One of the things that I didn't mention was something called the SHARP program, or Safety and Health Achievement Recognition Program. And this program is designed for companies who have excellent safety and health management systems. They can get up to a 3-year exemption from OSHA inspections. And a lot of times what happens is, we will go in and we'll see some things that need to be fixed. They're having a problem with injuries and illnesses. They implement a safety and health management system in place, and then things really start to improve. They get the employees involved, and then we identify them as a good candidate for SHARP. They get in the program, and just because of their implementation of a good safety and health management system, which is what SHARP requires, they continue to enjoy the benefits of reduced injuries and illnesses. Out of 120,000 small businesses in the state of Missouri, there's only around 30 companies right now in SHARP. So it's truly an elite group.
Very cool. And then if a company reaches out to you for a mock inspection, how long does it take to be on site for that inspection typically?
How long does it take to get there, or how long is the consultation?
I think, how long does it take to kind of get that scheduled? Do you need to schedule that a few months out in advance, or?
Yeah, usually about a month or two. I know on the Kansas City side, we are doing great. I mean, we could get to you right away on the Kansas City side. On the St. Louis side, we have probably about a month or two backlog on the St. Louis side. So it kind of all depends upon the part of the state, but really on the Kansas City side, we can get to the employers right away.
Okay, that's great. And then do you have any examples of, or what are your most impactful examples for building trades and manufacturing, for the building trades and manufacturing sectors?
Okay, can you say that again? I'm sorry.
What are the most impactful examples that you have for the building trades and manufacturing sectors?
Well, I know that, a lot of facilities that we go into, they'll if they have a union shop there, we always include the union representative when we come in and do a visit. So, it's always good to hear. I think a lot of times that the unions are really preaching safety and health, but I think it's always good to hear it from a third party. So I think that kind of helps the trades out sometimes, is to hear, reinforce what the unions might be trying to implement in a respective company.
And then are you doing mock inspections specifically related to COVID-19 concerns, or are all the mock inspections comprehensive?
No, the employer sets the scope of the visit. Okay, so when the employer will complete an application, and they will indicate on that application what they would like for us to do. So if they just want us to look at COVID type situations, that would be a limited service visit, and they would only be held responsible for the hazards associated with that limited scope of the visit. Okay. However, if they wanted us to look from a comprehensive standpoint, the technical term is like a wall to wall. If they wanted us to look at everything, they would just indicate, a full service visit, and we would look at, we would do a complete walkthrough of the workplace, identifying hazards, and then we would also be looking at written safety and health programs that OSHA required you to have. I touched on some of those, like a personal protective equipment plan, or a respiratory protection, or hazard communication. Those are just some examples of that. So again, the employer always sets the scope of the visit. So we're going to do whatever the employer would like us to do.
Okay, great. And then is it costly for companies to implement safety and health practices under SHARP? And then a follow-up to that is, are there funding sources available to help businesses that want to implement a SHARP program?
Not to my knowledge. The worst thing about SHARP, to be honest with you, is the paperwork. Making sure that when you develop a safety and health management system, you have to do some things like job hazard analysis and review of written programs and preventive maintenance schedules and all that sort of thing. And a lot of that takes time and some added paperwork. There are some situations where you may have to incur some costs, but you probably have to, if you were involved in a normal consultation, you'd have to fix those things anyway. But what I hear from employers, and I'm just being really honest with it, is just the paperwork side of it. But once you get the paperwork side of it done, and once you have that part done, then everything's you just have to maintain it at that point. And one thing I also want to throw out there too is that we have a safety and health management system course that we put on 4 times a year. We put it on in Jefferson City. It's free. It runs from 9 to 3:30 in the afternoon. And we basically step you through the incremental steps on how to develop a safety and health management system and to get in compliance with OSHA. So that's just another option. If anybody's interested, just contact us and we'll put you on the next offering of that. We had to cancel this month's offering because of COVID-19, but we hope to start those up. I think the next one's maybe in August, something like that.
Okay, perfect. Well, unless we get some other questions from Facebook, I think we can conclude, but I want to thank you for an outstanding presentation and your time and expertise, and of course collaboration and opportunity to highlight all the good work you're doing in this space. I know that it's just as important as ever right now. So really appreciate your willingness to share with us.
Absolutely. Thank you for having me.
So with that, I think we will conclude. And of course, if there's any follow-up questions that we haven't covered, I'm sure you can leave those on our Facebook page or in the chat, and we can reach out to Daniel again. So with that, I think we can